question is, how do we work through that impasse in that 15-minute hour to accomplish the things that are essential to accomplish and to document that they occurred? On the provider's side, it is our responsibility to put ourselves in a position of strength to support the patient's needs. And what do I mean by that? Understand cultural background that our patients bring to that encounter. Typical example, in Mississippi, a patient I'm aware of complained of a misery in her side for several years. Kept seeing her doctors, never found out why. Brought her to a primary care provider who was culturally proficient, who was able to understand that the misery in her side was what we would have called a flank pain radiating towards the umbilicus that is in this nature. Found a fungating mass on the kidney and was able to save the person's life. The cultural sensitivity of understanding how to communicate with that patient was key to that patient's survival. Now the question is, how do we infuse that, and how do we instill that, and how do we get our providers comfortable with that challenge? And it's got to begin from the time that they decide they want to be healthcare providers, whether they're physicians, nurses, or allied health. And it takes the mentors who help to guide them into those careers, it takes the people who educate them, and it takes the people who train. Far too often, cultural competency has been seen as a competency. Oh, I'll check that off. I've done so many of these procedures. And they don't learn how to integrate it into the activity that they do on a daily basis with the patients. And the other thing we do is we got to stop looking at the clock. Even though you are seeing patients in time segments, you got to see the patient for the patient's needs. If you invest another 30 minutes today, you may have saved 10 hours later. And it's all a part of understanding the environment in which we practice. And the last thing I'll mention on that is we've got to understand that there are language variances even when English is the only language people speak. And it's complicated when we have English as a second language. So we've got to find mechanisms to make sure that we provide for patient confidentiality, but effective patient communication. I can't get someone to join with me in helping them to deal with their challenges if I can't share with them if I can't have them share with me what I've learned from that experience, and have me share with them something that they can buy into to help them to get better. It is an essential component of sealing that deal, closing that contract, and having the patient do that. So we've got a challenge there in how we educate ourselves and our workforce.
So, thank you, Warren. I think